Good afternoon, everyone, and a very warm welcome to today's webinar, which is focused on innovating rural healthcare, which is our main question or theme for this webinar is how AI can empower family doctors, enhancing community health in underserved communities. My name is Navneet. I'm from Vayam, and I'm delighted to join you on behalf of Vayam, which is a community-centered initiative focused on designing evidence-based solutions specific to social challenge through data innovation and partnership. As we gather here on the occasion of World Family Doctor Day, it's a timely moment to reflect on the growing disparities in rural healthcare. In this session, we'll emphasize on technology, particularly AI, which has the potential to be a game changer in the sector of public health, which support family doctors in clinical decision making, bridge health access gaps in remote communities, and drive better health outcomes through smarter data-driven systems. We are honored to be joined by two incredible experts, Anuradha Katyal, who is a Deputy Vice President of Public Health Practices at Sambodhi, and Tathagas Dasgupta, a Senior Consultant at SCLI, who bring deep experience from health, nutrition, WASH, and rural development. With this note, I will now hand over to Anuradha, who will take forward the discussion. I will rejoin again during the question hour session of today's webinar. Thank you once again for being with us.
Thank you, Navneet. I think, first of all, congratulations on the launch of your webinar on the Family Doctors Day. Very good afternoon to all of you. Good evening to all of you. I'm Dr. Anuradha. So I emphasize on the word doctor. I think the way we are going to have this discussion between me and Tathagat is that I'm a public health professional. I'm a health systems researcher. And Tathagat is an expert in AI-driven solutions to public policy. And he's also been on the policy making side. So I think he comes with the two hats. And it's so happy to discuss with him. Tathagat, I'll just start with the fact that we all know that Ayushman Bharat, I'm just calling it Ayushman Bharat umbrella of schemes, has tried to make a dent in the public health system, which was really needed through all these years. There's a large portion of Ayushman Bharat which looks at hospital strengthening, at financial protection for tertiary care. But there's also a large section of Ayushman Bharat which also looks at primary healthcare driven models where the family doctors come in place. Now that's all very great. But that having said, our health system currently, if you look at the health systems in India, there are three key challenges. I think one is the receding yet existing burden of the communicable diseases. I think the second, I would say, is the fact that there is an epidemiological transition towards non-communicable diseases. And to top it all, as we are seeing today is a very hot day in Delhi, the climate change is pretty evident. Now, in this whole fragmented scenario, our health system is also fragmented. Obviously, the tertiary, the secondary, and the rehabilitative care somehow don't speak to each other. Now, to make Ayushman Bharat a reality, there is Ayushman Bharat digital mission. But I think I just want to understand from you that how this whole policy scenario can be expedited given AI. How can the service delivery be enhanced in a patient-centric, a family doctor-centric scenario? So over to you, Tathagat.
Yeah. Thank you so much for getting me in. I'm honored to be here, and thank you so much for the excellent question. I mean, this is a very interesting area where really AI-powered referral systems can create very intelligent patient pathways. What exactly you described, the Ayushman Bharat, quite a lot of AI algorithms. What they're trying to do, they're trying to match patients with appropriate health providers. So they are considering different aspects. They are considering the geographic proximity, the specialization needs, the real-time availability. In Tamil Nadu, they are trying to start the implementation where this state health department has already piloted connecting the primary health centers with district hospitals. So they are trying to analyze the patient history, the different sort of symptoms, the different sort of available resources, and then mapping it in a very nice manner. So this helps in determining the optimal referral pathways. There is a lot of predictive analysis which is getting done for patient tracking. There is, as you will agree, that a lot of private provider are also in place. And Apollo Hospital, they have implemented an AI-based command center which analyzes the patient data across different networks to prioritize cases based on the clinical urgency. So substantially reduce the waiting times. I don't have the figures exactly to what extent they have reduced the waiting times, but what they claim that they have substantially reduced the waiting times and obviously improved a critical care outcomes by ensuring exact time interventions. There is also a health information exchange system, which is enhanced a lot by these AI techniques. What they're doing is they're addressing the exchange. So there is a national digital health blueprint. This is incorporating the AI-driven data exchange protocols, which really interprets and standardize health records from diverse sources. And they are in rural areas where exactly what you said, fragmentation is very severe. There are organizations like Khushi Baby, which are working very widely in states in Rajasthan. They are using AI techniques. They are connecting the frontline health workers with very high level. They're ensuring the continuity of care for maternal and child health services through very smart wearables and AI decision support. So these are some of the things which are coming to my mind.
These are actually very great examples, like how different parts of the health system, like be it the health information exchange, which is impeded, can be, augmented by AI, how service delivery can be improved through AI, which I think Kushi Baby is doing. But you also alluded to a very important part, which is the resource mapping. I think the whole element of resource mapping, which is so relevant to healthcare. Uh, when we think about healthcare delivery or healthcare financing, we know that out-of-pocket expenditure in India has been relatively high. It is reducing significantly over the years. That's what the National Sample Survey has been showing. But still, it's relatively higher. And one of the key chunk of the out-of-pocket expenditure is the drugs and the diagnostics. And they are really tied to the resource mapping at the level of the right at the level of the PHC, the sub center, where care is actually given to the community. There are a lot of attempts which the government is making in terms of e-aushadhi, trying to have an inventory management system in place. But still, there is a large gap in estimating the actual needs of drugs and diagnostics, which can reduce the burden of the consumer on the private sector and hence reduce the out-of-pocket expenditure. So, in your opinion, how can AI help in the whole, supply chain, the logistics, the whole ambit of, drug delivery?
Yeah. So, as you mentioned about different sort of expenditure patterns, and this expenditure data is really, really interesting. Now, with this AI coming in, there has been virtually a revolution in sort of these different sort of health expenditure calculation. They can calculate historical consumption patterns based on some sort of data which is available with different sort of drugstores. They are calculating the seasonal trends. They are calculating different sort of disease outbreaks, and they are linking up with the different sort of demographic shifts and different sort of medication and different sort of diagnostic needs with much greater accuracy. So there is also some sort of supply chain optimization happening through AI. So this is effectively reducing costs. So Satyvatik, this is an Indian startup. This has developed a completely a blockchain and AI-powered vaccine supply chain management. This improves number one, transparency. This number two, reduces losses. So there is a vaccine ledger platform which is already there in Telangana as of now. And this uses predictive analysis, which I was mentioning just a few minutes back. They are optimizing distribution routes, they are identifying storage conditions, they are reducing the vaccine wastage. So it is basically a very successful program. There is also one very good project which is called the Coven project, or the Coven portal, rather to say, which is a population scale vaccine drive. So they started with the challenge that they wanted to ensure that 1.4 billion people are vaccinated with very big supply chain which are currently there in the country. So the solution what they gave was they launched an application in on January 15, 2021 for 30 million healthcare. So they are directly working with the providers, and the application team, they worked on understanding challenges which can arise. Its application became also available for senior citizens aged 60. And there is one very interesting data. When this application opens to 18 to 44 age group, traffic volumes, they scaled up within 1 minute from 6,000 requests per second to 46,000 requests per second. The Ministry of Family Welfare, the MIT, the AWS, they are using the Amazon CloudFront. And Covin scaled up to 4.9 billion requests that day. Also Covin runs very detailed analytical reports that provide insights. So the latest data which is available is as of March 2023. So they had administered overall 2.2 billion doses, including the first, second, and precautionary booster doses of the country approved vaccines. There are also a lot of AI powered for the service providers. And UP was one of the first state in India to come forward, which deployed a chat box called Swasthya in multiple languages. Obviously, this guide really guides citizens through available fee services. So if you are not able to find a good hospital around, if you're not able to get an appointment with a good doctor, if you need blood urgently, if you're not satisfied with the treatment, if you are able to figure out the right treatment, the tests are very expensive, they will give the solution. If you are not getting the right path of accurate treatment. So, sorry. Also, there is a lot of work which is happening on price transparency, which is highly related to the out-of-pocket expense. Often we see there are price transparency issues. So this Health Assure is working on that aspect, and they have developed an AI system that compares prices for common procedures and medications across health facilities. They will give that which one is the cheapest. You have already also incorporating AI to match the branded medications. So this is what is immediately I have in mind to answer this question.
Interesting. You mentioned Covin. I think Covin is one of the about 2.2 billion. That's pretty. I would say that's one of the exemplary things when it comes to AI and its utilization in healthcare. I think this is all great. But when actually it comes to analyzing the data, AI is definitely data hungry. And we know that at times the public data is either fragmented, in the sense it's lodged in multiple portals, or it is incomplete in nature. It's not complete in nature. Can there be a way, in which AI can help to bolster these data sets, and then, use the power of AI to do predictive and prescriptive analytics in the future?
Yeah, definitely. I mean, synthetic data is generated by AI on real world data samples. So these algorithms first learn the patterns, then see the statistical properties of the sample data. So there is an excellent example, which is called the Einstein Copilot. This is basically based on tackling the challenge of data. So mostly supply chains they have a lack of real-time data. And without actionable data, there is problem in modeling the systems. You cannot generate real-time reports. And here's where data analytics AI that come into place. So Einstein Copilot for Tableau, they can plug data gaps, generating synthetic databases where real data is inadequate. So that this Einstein Copilot really helps to anticipate the outcomes with predictive analysis, which will simulate diverse scenarios and uncover hidden correlations. It is also going to help different sort of people to do analysis who are in this field of health research, whether they have limited statistical understanding. Uh, they don't need a high degree in statistics. There is also a lot of data, AI, data in AI or AI in data integration happening. There's a lot of harmonization is there that how health information is getting consolidated. There can be different sort of NLP based matching algorithms which will actually recognize and link the patient records across different systems. Real-time dashboards, we all know that there are different sort of real-time dashboards, and I think we have seen the National Health Mission, how they are deploying different sort of machine learnings, which are continuously analyze the different sort of data from multiple sources. They have the HMS, the Health Management Information System data, the reproductive child level data, and district level inputs. So this natural language processing for unstructured data has another wide angle. They are also working in different states of India where thousands of ASHA worker data, in fact, they are thinking that this is not completely launched, and they are thinking of this ASHA workers data to get clubbed. So that what is going to happen is community health challenges will not be faced. And one of the leader on this sort of data set AI and exactly this sort of combining data is Vadbani AI, which this non-profit organization just developed several open sources. They have done. They are working on a voice recognition tool. So you have just have to ideally, if a new health provider joins as an ASHA or an ANM, they would be able to understand different sort of experienced ASHA worker cases. So the dialogues between a pregnant or a lactating, that transcript would be available in that local language. So quite a lot of work is happening. Still lot more to go, definitely. But yes, we are very, very hopeful that with the successful AI coming in, we will see this, we will overcome this challenge. That at least we are definitely hopeful on this.
Yeah, I think that's fair. That it's actually not adding to the burden of the work, but it's simplifying the work. Where it's the speech that can be easily converted to text, and that can be done in multiple dialects. Just coming to what I think Naveen alluded to earlier, it's the Family Doctor Day, and I think one of the strengths of family doctors has been the fact that they are aware of the burden of disease among the communities they serve. Now, what is lately happening that there is a rising burden of disease of non-communicable diseases. It comes without saying that we are seeing this emergence of non-communicable diseases in large proportions. There is a lot of there is a large chunk of population. In fact, you just see the news. You see a lot of celebrities, a lot of entrepreneurs who are seemingly of good health succumbing to a sudden episode, a sudden stroke or something of that sort, and many of them you get to know are diabetic. With the silent killer, which has led to multi-morbidity, premature mortality, how can actually AI help in the prediction of the population at risk?
I have lost you, Anuradha. Anuradha, I'm not able to hear you.
Yeah. I was just asking about the increasing burden of the non-communicable diseases. The fact that, family doctors used to act as a conduit to understand what's the burden of disease among the community. So how can AI help to predict the population at risk and identify the belts or the zones of population and catch them sort of early to mitigate mortality?
Okay. Yeah. This is really very, very crucial because understanding the true burden of disease is very for health system planning and challenging, but AI is offering very promising approaches. AI NFHS from the sample SRS data, sample registration system data, different sort of hospital records, the community service, which will obviously include diseases like TB, different sort of eye care, and they will give very good predictions and very good estimates that what's going to come up in the future, and the service delivery mechanism can plan accordingly in which part exactly this prediction is possible to do. And there are also NLP tools for analyzing clinical notes, which will really uncover the hidden patterns. I'll give you an example. This is not tested, but I was reading in one article that researcher would be able to really apply NLP over a sample of different sort of psychiatric consultations to they will be able to recognize the patterns of comorbidity, and comorbidity is an issue here. So for example, different sort of mental health conditions and physical ailments. So maybe there is a thyroid disorder, and the data will show you that this was significantly underdiagnosed among patients with depression, the thyroid disorder. So this sort of trends will come in when these sorts of clinical notes are analyzed. There is also one computer vision analysis of medical imaging which is happening. So for example, the AI powered chest X-ray, which is extremely important for these TB centers in India. They will not only detect tuberculosis, but it will also identify the patterns of COPD. They will identify patterns of or symptoms of early heart failure, lung cancers. Also, in this area, Niti Aayog is working a lot on this diabetes aspect, which you had just now mentioned. They are developing an AI algorithm for detection of earlier signs of diabetic retinopathy in diabetic patients, and to scientifically validate the algorithm, which can be used as screening tool in the primary healthcare. That's what is in my mind at this moment.
I think for me, there are three key takeaways from all these points, very relevant examples which you have put out. One is the fact that how governance, overall, the governance of a health system can benefit through the utilization of data, through better monitoring, through better evaluation, and in turn, better supervision. That's one element. The second element, which really stands out, is the whole ambit of service delivery, be it the primary healthcare. You gave a lot of examples on how primary healthcare can benefit, how hospital healthcare can benefit, how the supply chains, the cross-cutting supply chains can benefit, and how finally, to top it all, how the health financing could benefit. You talked about the actuarial data, you could use synthetic data sets to generate a lot of information. But to top it all, to kind of connect it all, there is the health information exchange, which is definitely needed for a strong primary health system and in turn for a family doctor-led system. So I think for me, these are the key takeaways. If you have any closing remarks, otherwise we'll hand it over to Naveen for Any audience questions or any other discussion points?
Yeah, I what I feel is obviously India will need significantly more healthcare professionals. So here again, AI will come into place because as you know that currently the doctor-patient ratio is about 1:1,500, and the WHO recommendation is is to 1,000. Even the nurse population is low. So in actual service delivery, when AI will feature in and they will provide some certain sort of powered clinical decision support system, this problem will solve. And in country like India, telemedicine is coming in slowly and slowly. This mobile diagnostic devices are coming in, which will extend specialized capabilities to the remote areas. There will be smartphone based eye examinations. We have to use it more carefully. Good dissemination needs to be done. Which will come to the health providers, which will really facilitate and make lives much better. And that's what we can hope and we expect. Yeah, that's all from my side.
Thank you so much. We hand it over to you, Navneet.
Thank you, Dr. Anuradha, and thank you so much, Tathagatji, for your rich and insightful discussion. What I will do that I will put forward two questions to each of you, and we can emphasize um, based on that on the question. So, first question to you, Tathagatji, that have there been, because you spoke about COVID and Khushi Baby, different things and all, but there is a specific question that is there any successful example of using AI in primary healthcare and basically in underserved areas? And what can we learn from them? And what can you take away from this existing platform?
Yeah, definitely. I can give you certain examples, which is exactly used at the grassroots healthcare. For example, there are diagnostic tools like different sort of images scanning, different sort of text result scanning. There are different sort of AI chatbots, which is really helpful for the health workers with up-to-date knowledge. And this is available in different sort of languages. There is a lot of thing happening. This has started, but this is gearing up widely is the data collection and management. So health data, I'm not talking about the survey data exactly, but health data. Health data is getting collected through AI. There are different sort of disease strains which are analyzing, I mean, coming in understanding much better. Remote consultation is again one area which has started in penetrating in rural India. Supply chain, I have already spoken about. And what I feel is that the lessons learned is the main thing is all these things should be adapted to the local context. So otherwise things will not get successful. So all the AI tools which are getting developed or which can develop, they should be tailored to the local language. They should address the relevant diseases in the local context, the cultural practices, and there should be integration with the existing systems. So rather than completely replacing them and getting into a new system, they can tie up with the existing systems because India has already spent so much of money in healthcare since independence. So they should always add up to the existing healthcare system. So these are the two things, lessons learned, which is coming to my mind.
Thank you so much. I think there is one next question, so which is coming from our experience of AI, especially because when there is a digital platform technology, there are a few challenges to it, and when we will take downscale to it towards the more grassroots level. So the question is that how AI can be handy for these grassroots health workers, and what are the things that needs to be considered?
Yeah. So obviously, which needs to be considered are these sorts of technologies should be made available in the first place. There should be good connectivity everywhere. Still, there are remote areas where connectivity becomes an issue. And obviously, training is one good area. AI, because I'm coming from the point, I have taken several trainings on AI. There is still some sort of fear which exists in AI, which is not completely unjustified. There has been mishandling AI issues also. So this sort of training will completely remove the fear where whether AI will not go right. These sort of things may be met. But ideally, this sort of chatbots, I mean, which are the end user application? These sorts of application works very well with users. They need not be bothered about that. What is exactly behind getting into this AI tool? So, and in my previous answer, I also mentioned that what will really work is adapting to local conditions where there is some sort of rigidness. Things should be handled in a more different manner. Obviously, connectivity is one issue across different areas, particularly in remote areas like Andaman and Nicobar Islands, Lakshadweep. Their connectivity is very big issue. Even you don't get mobile connections also. I mean, you may not think about internet connectivity regularly. So these things should be sorted, and different sort of mobile health applications should be promoted much more in different sort of personalized treatment plans.
I think thank you so much. These are very in terms of the specific things that when in terms of innovation and making it enable for the adoption of the AI technology can be considered. And digital infrastructure is one part, definitely considering the geography and penetration of it. So taking forward this, I think I have two questions for Anuradha as well. So Dr. Anuradha, just we want to know that what are the some ethical concern or risk which is involved in deploying AI? So because coming with the perspective of health indicators and various insights which can be accessed or hosted towards different platform. So what are the basically these concerns, especially regarding the data privacy and consent?
Yeah, sure. I think I'll just build on what Tathagat mentioned around the National Digital Health Blueprint. So along with the National Digital Health Blueprint, we had a health data management policy which was launched. Now, the health management data policy actually talks about the architecture of Ayushman Bharat Digital Mission. It was known as National Digital Health Mission, NDHM at that time. So with all the artifacts that National Digital Health Mission, or ABDM now as it's known, has, there is an artifact of informed consent, which is very obviously very important. It's a part of the whole architecture. Now, that having said, there needs to be a deeper understanding when the people are collecting the data of what is one, data privacy, which is through informed consent, and the second is what is data safety. Now, data safety is something which is essentially over and above. It's the policy when it comes to data. Now, ABDM governs the data through something known as federated architecture, which means essentially that the data which is present at the level of the facility, the decrypted data which is at the level of the facility, whenever it is given to the higher ups, it has to be encrypted, which means even the district officials will not have access to the patient data. So that's the second level of just trying to understand that there are a lot of misconceptions also when it comes to ABDM, but ABDM has taken care of all these things in its whole discussion, its policy ambit. I think the last thing which I want to speak about is that unlike a lot of other countries, India has a opt-in policy, not an opt-out policy, which means that I can choose to become a part of a system, or I can choose to not become a part of the system. Unlike a lot of other countries where you have to become a part of the system, then later on you can opt out. So in India, that's still voluntary, largely voluntary. Same for the public health same for the private and the public health organizations also. So I think these are some of the things which govern the I think privacy in terms of data. obviously AI is a very different ballgame altogether. I'm not going there, but at the level of the data collection, these are some of the safeguards which are at place. And AI is probably a whole different lot of discussion, which probably we can have a part two of this webinar. We propose that.
Definitely, sure. I think uh,
Definitely.
we'll go ahead this. And one last question to you, Dr. Anuradha, that because we are talking about data, AI, and use of this data. So there is one strong pillar or the connecting factor, which is the community health workers, and they play an important role in terms of overall the ecosystem of data and related to health. So what is the, how they play in bridging this gap between this AI-based tool and the rural patient? Because they are the basically play mid role in terms of connecting this data to a platform. So what is how they are, what are the role that they are playing that is bridging the gap between AI-based tool and rural patients?
So I just was counting the number of times Sathagat said contextualization. I think that's a very important word in the whole discussion of AI and ML when it comes to the Indian health policy ambit. So contextualization or understanding the colloquial terms and translating that to a clinical decision support system is only possible if we are constantly in touch with the frontline workers and the community health workers who understand the community language better, and also the picking up of the dialects, like uh, I mean, when I've worked a lot in South India, so at times I don't really understand the terms which are medical terms which are used in North. So there are some very typical terms which are used, and that will add to when the patient actually gives his history, the chief complaint, that it has to be recorded in the same language. So I think that understanding the community health workers bring in. The other thing is they are the ones who are going to adopt it and adapt, and eventually we would adapt it according to their needs. So I think the needs assessment should start with the community health workers. But when you're trying to understand what has to be the need of the community health worker, it starts at that level. And then it goes bottom up and not top down. So I think, and data is also collected bottom up in India. So maybe that's something which I feel is their role to play, and that can in turn be connected to the rural population.
Yeah, I think that is the consistent process which will happen, and maybe a lot of other players in this ecosystem who have a strong responsibility of connecting this data to a larger platform, and especially the community health workers. So we'll continue this conversation in terms of like who are these other stakeholders, how they can use best of it, and they can also be part of it. So we'll continue this discussion. And thank you so much, Dr. Anuradha and Tathagatji, for this thought-provoking insights. And what we have heard today, which reinforces the immense promise of AI, which holds like transforming rural healthcare, but also remind us the real challenges around equity, access, and responsible adoption. So at Vayam, we believe the future of healthcare must be collaborative, community-driven, and tech-enabled. So in today's conversation, we bring one step closer to that vision. And we are grateful to each of you who has joined this webinar, from public health professionals, NGO representatives, and community health workers, including researchers. So a big thank you to our speakers again, and for generously sharing their times and expertise. We wish that we'll continue this session again in a more informative and more collaborative manner. So thank you once again. I wish you all a great day ahead, and thank you once again, and goodbye.
Thank you.
Bye bye.
Most welcome. Take care.